Good day to you, everyone. I want to welcome you to another edition of Insurance Talk Show. Today, we shall be discussing a topic that will affect every age. Let me say every age. At least to the age of getting close to the grave, from 0-year-old till maybe 65 or 70 years. I want to believe I'm right. Yeah, that's the topic we'll be discussing today. Everyone is going to benefit from it. And I have somebody wonderful with me here. I am Bola Adegbaju. I have Mr. Ayodele Akeeb with me. Mr. Ayodele Akeeb, you're welcome.
Good afternoon, madam.
Yeah, thank you so much for coming.
Thank
Mr.
you.
Ayodele Akeeb is the Group Head, Retail, Partnership and Public Sector at Zamansard Health Limited. Once again, I want to welcome you.
Thank you.
Our topic is health insurance. I know a lot of us have been hearing about HMO. Now we are going to talk about HMO. Mr. Ayodele Akeeb, what is health insurance? And who are these HMOs we are talking about?
Thank you very much, first of all. The listeners and the viewers at home, thank you. And
Thank you.
for having me here.
Yeah.
Health insurance is simply as simple as it sounds.
Mhm.
So, simply put, health insurance is just the healthcare financing model.
Mm.
So that borrows or adopts insurance concepts
Mm.
to the model. Simply put, it's a pool of fund from the majority
Mhm.
to which is used to treat the minority sick. So
Mm.
put it that way. I think for a layman, it's better put it that way. So
Mm.
thank you.
What services do they provide? Because I've been hearing about HMO for years before I enrolled as an enrollee last year, But I've been hearing about it for long. I never understood it. I never saw it as important until last year. Can you just explain to us what services you render?
So traditionally or essentially, an HMO, which means Health Maintenance Organization,
Mhm.
so essentially provide healthcare services through insurance concepts. Traditionally, I said traditionally. So, but the HMO of these days transcend beyond providing only healthcare. So it's all about the total well-being of our generally our total well-being. It goes beyond curative. It goes to preventive and well-being entirely. So that's what HMO should do.
Okay, thank you. Which body regulates these HMOs? Which, like in insurance now, we have National Insurance Commission. So for the HMOs, which body regulates them? Because there must be a guide. You can't just begin to operate in the industry like that. There must be a body that regulates. Which body does that?
Yes, and the National Health Insurance Authority. It used to be known as National Health Insurance Scheme. Well, from last year when the healthcare bill was passed into law, so it now empowers the regulator, the body now from being a scheme now to an authority, National Health Insurance Authority. However, even at the state level, so the authority also gives authority to states to also have their state level authority. Like in Lagos State, we have LASHMA, that is Lagos State Health Management Agency, which also LASHMA. So at the state level, so we also have regulatory, just like we have Ministry of Health and State Ministry of Health.
Okay.
But at the federal level, and ultimately it's National Health Insurance Authority, NHIA.
Okay. Thank you so much. Like in general and life insurance companies now, the CEOs are insurance professionals. So in the HMO, who is the CEO? Who is the head of health management organization?
So, okay. So, first of all, I would like to establish that health insurance business or HMO business, whatever you like to call it, is a business. First to get that. So, it's not compulsory that the head or CEO must be a medical doctor. So, well, yes,
it's not compulsory.
It's not compulsory, but it's of course, by the regulation, there must be somebody at the top management level who is a medical doctor and that must have a large number, a quite high number of medical experience. Okay. So, but it will be another advantage, of course, if the MD could be a medical doctor. So it's another advantage. But however, so we've seen that in the industry, the players or the HMOs that have actually revolutionized the industry, they are MDCOs and they are actually not medical doctors. They are business people who are from different fields, but business minded. They run it as a business as much as healthcare. So healthcare business. So
thank you. Do you know why I asked this question? You know, I once worked in a group, and the group has HMO, and I noticed that the HMO, the head of that group or head of the HMO was a medical doctor. So I was now like, must it be a medical doctor that will head the HMO? That was why I asked that question. Thank you for the clarification. So it's purely business. Yeah, thank you. So when we talk of general insurance companies, you know, I am an insurance professional and I am comparing most of these things with insurance. Of course, HMO too is about the health insurance, you know. So I have to be comparing so that people out there will understand the differences and what it is all about. So when we talk of general insurance companies, there is an age limit for cover. Is it the same with HMOs?
Yes, there is an actually insurable age. So yes, so but however, like I said, the new HMOs, modern HMOs, so of course will transit beyond traditional thing. So people are HMO are now looking for a way to also cater for people outside the scope of what the regulation says. The regulation says 0 to 65, used to be 60, but now the new regulation, of course,
from 0. So a newborn child, you know, can be covered.
Sure, right from the day one is. Even right from when the child is in the womb of the mother, she's already been taken care of.
So the HMO covers pregnancy.
Yes.
Okay. If you are out there and you are hearing us, I want you to understand what we are discussing. We're talking about health insurance, and I want to encourage you, if you are there and you have not taken up health insurance, I think it's very, very good. It's important for you. You can hear Mr. Ayodele Akeeb saying even the policy, you know, covers pregnancy. So if you are a pregnant woman and you have
health insurance,
then you are well covered. You are well covered. So
let me just give a clarity on that. Okay. So for in HMO, my company, for instance, we have 2 line of products. So we have products for individual, that's personal product, which you call it, and we have for corporate. So for corporate, it's a group of companies or establishment organization with a certain number. So when you're on the corporate plan, automatically you are covered for all the pre-existing conditions, chronic medical conditions like hypertension, diabetes, and pre-existing conditions like pregnancy, or somebody was already sick before you sign up. Yes, that will be automatically covered. But if you on a retail plan, so there is a moratorium. So there will be a moratorium of 12 months. I'm using my the system as an instance. Some have different periods. Some will say 24 months, or from is 12 months. So once you have observed that moratorium, so that means moratorium means the period at which the chronic or pre-existing condition will not be covered.
Once you pass the period of observing you,
exactly.
They will observe you for 1 year.
Yes, exactly. So once you pass that, automatically, so you are covered for every other thing as long as you don't break in the on the scheme. So as long as you stay on this, so all this will be covered, including pregnancy.
Okay, I noticed also that there are different plans. Can you just explain, like, okay, we have this one, a lower one, this one is higher. I know there are different plans, so it is not the same thing. The kind of policy one takes is not the same with the one another person. It depends on the premium you pay. You pay.
So the HMO product is designed in such a way that it helps you to take care of your to get your plan according to whatever your objective is. Is it budget? Are you using money as or whatever? So we've designed different plans. Some will design only 3, some will design 4, some it depends on how the capability of the HMO. So but in whatever plan you have chosen, it's just only to show the level at which you want to be taken care of. Some will be able to take it at primary level, secondary level, tertiary level. So some will be able to take it to primary and tertiary, and secondary level, may not be able to take it at the tertiary level. So all this determine what you feel you want to just cover. Some will think that, oh, I'm already covered for some certain, I have access to some other benefits somewhere. Let me just cover myself on the very low end. Then when I have, some will want to say, oh, maybe when it gets there, let me just take a more smaller. So, but whatever it is, what is important is that whatever plan HMO is offering you, it should be able to address your need. So your objective of choosing that plan at any time. Yes.
Okay, thank you. I have a question here, and the person said that he is up to 60 years, and he was turned down when he went to the hospital for a general body health check, and because he had initial health issues, at the point of signing in, the person was turned down, and he was asking, are old people excluded from HMOs?
No, old people are not excluded. Maybe we may need more data or more information, but what I suspect happening is, okay, it depends on the HMO where you are. So some HMO do not cover. That's what they call where persons check. Where persons check is nothing is wrong with you. You're fine. You just walk into the hospital and you'll be asking for, do this for me, do that for me. So that is called where persons check. So you rather go to the hospital, present your complaint, and let the doctor, a medical expert, say, do this and do that. And again, some HMOs, good HMOs, have already put health checks is part of your plan. So annually, you can have some specific or some selective number of investigations done as a medical check. Okay, so now, if you now go to the hospital asking for something outside that, as where persons check, not that you are sick and the doctor say go and do this, you are the one asking for that. So insurance may turn it down. It's called where persons check.
You don't do it. What I'm trying to say now is that you don't go for a general checkup or test at the hospital. You go to
it could be hospital, it could be diagnosis center, but if you don't have any basis of doing it other than for wellness, I just want to know. So it should be according to what is being provided under your plan. So if your plan has provided like 8 investigations and you want to do like 15, so you will be limited or constrained to only the 8 that your plan has provided. Remember, as a web person's check, nothing is wrong with you now. You just want to know the state of awareness.
Well, it's just that's almost like a general checkup now, as in general test, general examination.
Yes.
But it's also good, and you said it's part of the package
yes,
that you
it's part
have.
of what we have.
So why was the person turned down then?
So, like I said, depending on except when
the person said he had issues with BP. Let me say he's hypertensive.
Okay.
You know, and that was the basis of turning him down
Certainly,
for a general checkup.
certainly we'll need more. We certainly need more details. So we can't judge blindly.
Okay.
But like I said, I've said earlier that remember when I discussed more, I talked about moratorium. So all this also. So could this be that this person is supposed to be on moratorium and the person has not? So all this needs. So HMO, insurance, health insurance is a contract. When you buy health insurance, you have policy document. What is important? Study your policy document very well. Even before you buy, understand what you're buying. Know the limitations. Know what you are covered for, so that there won't be any ambiguity or any argument when at the point of service. That is actually also important.
Thank you, Mr. Ayodele Akeeb. I think we have to go on a break now. Yes, we are back. Good afternoon once again. This is Insurance Talk Show. I am Bola Adegbaju. I have here with me Mr. Ayodele Akeeb from Axamansard Health Limited, and we are discussing health insurance today. So, Mr. Ayodele, most people think it is too expensive to enroll with an HMO. What advice will you give to the people out there? Because I said it also that I knew about HMO, but I never saw it as something important, something I should do until last year. And I know a lot of people are out there just like me. They hear about it, they know about it, but they didn't even bother themselves about taking out health insurance. What can you tell people about
Okay.
this?
I'll start by using because I've said it that is a healthcare financing model that borrows insurance concepts in its operation. So, and in insurance, we say insurance is something you buy when you don't need it, but you regret not buying it when you need it. So, HMO, health insurance is the best way you can buy the best way you can take care of your health, because it gives you a lot of benefits. It allows you to plan your budget very well.
Yes.
Of course, you know how much you earn on the minimum monthly, annually. You can buy an HMO plan, look at the plan and say, if I buy this plan, come what may, I know I'm already covered for whatever must have come, surgery, anything that might come. So you have looked at the benefit and you have paid for the price. So when it comes, when it happens, of course, which it may not, of course, when it happens, you are already covered. You are not going to be under pressure of calling uncles, going to churches and raise money. You are already covered. And some surgery could be so expensive, as expensive, run into millions. Imagine if you do not have insurance.
Will the HMO do that?
Yes.
The ones that are running into millions.
Yes. So when you buy HMO plan, it's very transparent. You buy, you can see what you are covered for.
Yes.
Where your plan has limitations, it's already explained that you have limitations. But you can see where you are buying a plan of 60,000 naira, around 60,000, and you're having a benefit to run to 800,000. You can see. So that's a wonderful thing to have.
Thank you so much. And one thing again is that most people believe it is for rich people.
No.
As in HMO, signing on with an HMO is because you are rich. And I want to let you know out there that it is not only for the rich people. Whatever amount you are earning, you can bring it out. And the cover is for 1 year.
It's for 1 year.
That's another thing.
Let me give this analysis so that people will not know. People will know that HMO is not expensive. So if you don't have healthcare or healthcare plan, if you look at how much you spend on agbo or going to the chemist and buy drugs, and or you are in the public vehicle most of the time and somebody advertises something to you, this does that. So most of the time, if you calculate how much you buy, how much you spent on all this, most of the time they are much more than what you could have used to buy healthcare. Just because you are not paying that money once, that makes it to look as expensive. But good thing now that HMOs are now being innovative these days. They have allowed you to pay monthly, so make it more cheaper. Thing. So maybe because you are not paying monthly, that's why we make it look like as if it's expensive. In fact, it's the cheapest.
You can pay monthly
form of
now.
Healthcare.
So if you
HMO now
if you don't
use
have
of
so
it
much
pay,
money,
yes.
you can break it down into quarterly,
So,
into
yes.
monthly,
And
and
of
you'll be
course,
covered.
it may be expensive now that it has been it's been made compulsory. The guideline is already on work. So by the time it's been well implemented, it's compulsory for every Nigerian to have health insurance. So the more we have more people on the scheme, the price will be coming cheaper and cheaper. And of course, there may be very different innovative way to pay and make the payment convenient for you. In fact, it's the cheapest option of healthcare we can
Thank
think
you.
of.
There's somebody here also who is saying that he has been under observation, moratorium, or what do you call it? Moratorium. Yeah, that is he still under observation? I want to believe the person does not really understand what we're trying to say. If you are under observation for 1 year, as in it's just for 1 year, so after that 1 year, you are covered. So the moratorium period is 1 year, as Mr. Ayodele has explained.
Yes.
So after 1 year now, you can begin to enjoy whatever you have signed on for.
So let me also clear that I don't know what HMO this person is. It's like I said, some HMOs have it as 24 months, some as 20 months. Whatever moratorium your HMO is, it's important for you to understand that. And what moratorium means is the period at which HMO will not treat you for some certain conditions. So they want to be sure that you are not actually coming to game the system. You are actually buying insurance as because you want to buy insurance, not because you want to transfer the liabilities. Yes, of course. So and that is the period. So once you are able to stay to that period, and when it is due for it, you are due for it, and you renew in due time, definitely that will be waived, and you now come into the stream properly.
And one thing you mentioned again is that when you are under moratorium and it's 12 months, you should not have a break. I remember that.
You should not, yes. So you must renew within.
A break,
once you have a break, you have to start all over again as if you are starting all over. So once your once your policy expires, you have to renew in due time. So maybe you have a grace of like 7 days, but you should be able to renew within that 7 days.
Okay, thank you. Let me quickly say something about what I have here. Okay. There is an ongoing insurance quiz competition by Nigeria Council of Registered Insurance Brokers. It is being organized by Nigerian Council of Registered Insurance Brokers, NCRIB. The quiz competition is going on right now for secondary school students, and it's taking place at NCRIB House, 58 Moleye Street, Yaba, Lagos. It is tagged Catch Them Young. There's a project insurance industry is trying to do to make the youth, the young ones, understand insurance. So we are trying to encourage them to come into the insurance profession. So I also have some vacancies here that I want to announce. A life assurance company needs people to fill the following positions: head of technical, manager, enterprise risk management, manager, internal control, head, Takaful, manager, finance. These are 5 positions, and you can send your CV to Raymond at umbrellainsure.com. Raymond at umbrellainsure.com. That umbrella is OM, not UMO, is OM. Raymond at umbrellainsure.com. So you send your CV to that email address, and you make the heading the position, as in for head of technical. Now if you are applying for head of technical, you make the heading of your mail head of technical. That will be the position, that will be the heading. So just note that. Mr. Ayodele, there's one more question I have here. Okay, for an HMO who is not providing the services paid for, what can they really do? If there's an issue, you have an issue with
there are different ways to where you can approach HMO, or you can address complaints from HMO. First of all HMO have a customer service team. So some of the time, these services are provided by a third party called a provider. So that's the hospitals. So sometimes fault may not, whatever you experience may not be a fault from the HMO. Maybe there is a gap, there is something, service gap from at the provider end. And sometimes it's not deliberate. Maybe the person that is attending to you is not properly also informed. Ensure that one, you can address, every hospital have their HMO officer. So you can ask for the HMO officer at the hospital, whatever complaint you have, address it
If
with
they
them.
don't, if the
So now
hospital
that's
does
why
not,
there are now escalations. You begin to escalate. If you cannot be addressed by the hospital, then contact your HMO's customer service to
okay,
report.
if the HMO is
So-
not doing
So
it
then,
again,
so if it is so, of course we expect that it should be resolved. Or if it is not resolved, you can report to the regulator.
to
But
the
before you
regulator,
can,
because
that's the
what
last
I want
result.
to know.
And
That's
that is the last result. So,
yeah.
but you must have make sure that you find all of the options to make sure you resolve this before it gets to the regulatory level. So that's this how you can address this.
Is health insurance related to travel insurance? Because I've seen people
No.
asking that question.
No.
When you say you want health insurance, they'll say, you know,
No. So
okay.
health insurance is purely on for your health, but travel insurance have various elements. Travel insurance is an insurance you have when you're traveling out of the shore of your country where you live. So it covers your emergency return, repatriation or return back home. It covers loss of luggage. It covers
Your health
medical
too.
emergency. Because of the medical emergency, that is when majority of the people actually buy beyond other benefits. So, but it covers beyond medical. It doesn't cover not only medical. So, but medical is one of the elements that is covered under travel insurance. So, you'll be able to get reimbursed for your emergency medical expense you make while you're on your trip. Yes.
Yeah, out there.
So, but it's different from health insurance.
Okay. A lot of people complain that hospitals, the hospitals are the providers, care providers, they don't attend to them on time when they use an HMO. Like I have experienced it before. I was in a hospital and there was a patient there. Because the patient was using HMO, they did not attend to her on time. In fact, the patient had to decide to get money and pay by herself because they did not attend to the HMO that she was using. So what can be done about that?
Okay, so actually this complaint is becoming unpopular these days that now HMOs are waking up to their responsibilities. Before we come on board, for instance, we came about at a time when people don't trust HMO any longer. You have HMO card, hospital will look at you as a second filter patient and say,
yes, this one doesn't have money.
Yeah, so
why you're using HMO.
Then because HMO were owing hospitals.
Yes,
so they were owing them. So some will tell you, okay, madam, if you want this care, you have to pay. But interestingly, when we came on board, so we were able to change, revolutionize the industry. And we are happy today that lots of some HMOs too have also take over the baton and also doing well. So now, when you want to choose a HMO, you have to be careful. One of those things, apart from you have listed, they have seen the benefits, everybody have listed their benefits. And so one of those things you need to independently check for or look out for is what is the relationship of the hospitals and the HMO, that is the provider. Where your provider, when HMO meets up to their obligations to their provider, of course, you are the highest payer to that provider. They won't joke with you. A typical HMO that pays their due very well to the hospitals and have
so how do you know that? How do you know the HMO that pays?
You can independently find out that you know the hospitals you want to use. What can you want to use HMO and you want to? You can check for get testimony
from your hospital.
So yeah, but where HMO is doing well and they are living up to their obligations with the provider. In fact, it will be the most of the from my company most of the HMO hospital we use. We are the highest payer in So even the other HMOs, you pay them a lump sum of a kind of money that if they lose that business, it means something to them. So once HMO is doing well, paying the provider promptly, so of course you can get good care. So one of those things you should look at for what's the relationship of the HMO and the provider. So that helps to facilitate the kind of care you get in that hospital.
Thank you so much, Mr. Ayodele. Do you have something? Any word for the people outside there?
Okay.
Any encouragement? Any advice?
Yeah. So what I need to tell people is it's a popular saying that your health is your wealth. So we all know that. But how much do you understand this? It is now. That's what is important. So one of the best way you can take care of your health is employing getting an HMO plan. Beyond going to an hospital, there are a lot of things that your HMO will do for you. HMO will help you to standardize the quality of care you have. Because there is somebody behind. Every HMO system have a quality assurance team or medical services team that they get to know how you've been treated at the hospital. They intervene and they standardize that. You may not know that at the back end. So they tell you this and this, and they tell the hospital on your behalf. That's number one. HMO gives you the wide coverage, wide access to hospital. You are in Lagos at the moment, you find yourself in another part of Lagos, or even another part where you can. So your HMO policy plan goes with you anywhere you go to. So it helps you to, and of course, it saves you from that the shame of that rainy day when you don't have. If you don't have, you fall ill when you don't even have a dime in your bank account. So one of the wisest decisions you can take in taking care of the healthcare system is buying an HMO.
Thank you.
And there are a couple of HMOs out there that you can actually go out for. But please, it is important. It's one of the insurance policy that you can even buy as a gift for people. Rather than these days, people are buying different kind of gifts for couples getting married. Buy them health insurance.
Thank you.
So
thank you. Yeah, that you can use this HMO package as a gift to your loved ones. And thank you, Mr. Ayodele Akeeb, for joining us. I look forward to you joining this program, Insurance Talk Show, at this same time next week.